Black maternal mortality represents a stark and unsettling reality in the United States. Black women are 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. This disparity reflects deep-seated systemic issues within the healthcare system and society at large. It's not just about individual tragedies, it's about a systemic failure to protect and care for Black women. Addressing Black maternal mortality requires a comprehensive approach and systemic changes. The disparity in Black maternal mortality rates cannot be understood without acknowledging the historical context. From slavery to segregation, Black women have endured medical exploitation and mistreatment. They were subjected to horrific medical experimentation without their consent. The medical racism experienced by generations of Black women has created a deep-seated mistrust of healthcare providers. Addressing the present-day crisis requires acknowledging and understanding this historical context. The impact of institutional racism on Black maternal health is undeniable. Institutional racism refers to systemic policies and practices that perpetuate racial inequities. In healthcare, it manifests in unequal access to quality care and implicit biases. Black women face barriers to comprehensive prenatal care. Implicit bias plays a significant role in healthcare disparities. Studies show Black patients receive lower quality care. Bias can manifest in dismissing a Black woman's pain. These microaggressions have a detrimental impact on health outcomes.
Certain health conditions, like obesity and hypertension, are more prevalent among Black women and contribute to increased risks during pregnancy and postpartum. These conditions are often intertwined with socioeconomic factors, such as limited access to healthy food options, inadequate housing, and exposure to environmental toxins. Obesity, for instance, can lead to complications like gestational diabetes and preeclampsia, increasing the risk of premature birth and other adverse outcomes. Similarly, hypertension or high blood pressure can have serious implications for both mother and baby. We see a higher prevalence of these conditions in the Black community due to a complex interplay of factors, including genetics, lifestyle, and access to healthcare. It's crucial to address these underlying health issues through preventive care and early intervention. Addressing these disparities requires a holistic approach that goes beyond simply treating the symptoms. It involves addressing the social determinants of health, such as poverty, food insecurity, and lack of access to quality healthcare that disproportionately impact Black communities.
Section 5. Voices from the Front Lines. Stories of Loss and Resilience. Behind the statistics are real stories of Black mothers and families who have experienced the devastating consequences of this crisis. Their voices provide a powerful testament to the urgent need for change.
Take, for instance, the story of Simone Landrum, a 30-year-old woman who died from childbirth complications after repeatedly expressing concerns about her health to medical staff. Her family believes her concerns were dismissed due to racial bias, highlighting the tragic consequences of implicit bias in healthcare.
Another heartbreaking story is that of Kira Johnson, a 39-year-old attorney who died from internal bleeding hours after giving birth to a healthy baby boy. Her death, deemed preventable by medical experts, sparked outrage and calls for accountability within the healthcare system.
These stories, though heartbreaking, also highlight the resilience and determination of Black women and their families. Many have turned their grief into advocacy, demanding better care for Black mothers and working to dismantle the systemic inequities that perpetuate this crisis. Section 6. Community Action, a Beacon of Hope. Amidst the stark realities of Black maternal mortality, communities across the country are taking action. Grassroots organizations led by Black women are working tirelessly to address this crisis and provide support to mothers and families.
Organizations like the Black Mamas Collective, Sister Song, and the National Birth Equity Collaborative are providing education, advocacy, and support services to Black mothers. They are working to improve access to quality prenatal care, promote culturally competent care, and empower Black women to advocate for their health.
These organizations are also instrumental in raising awareness about Black maternal mortality, advocating for policy changes, and holding healthcare providers accountable for providing equitable care. Their work is critical in addressing the systemic issues that contribute to this crisis.
Community-based doula programs are also playing a vital role in addressing this crisis. Doulas provide emotional, physical, and informational support to mothers during pregnancy, labor, and postpartum. Studies have shown that doula care can lead to improved health outcomes for both mothers and babies, particularly for Black women.
Addressing implicit bias within healthcare is crucial to improving Black maternal health outcomes. Implicit bias training for medical professionals is essential to raise awareness about unconscious biases and their potential impact on patient care. These trainings aim to help healthcare providers recognize their own biases, understand how they manifest in healthcare settings, and develop strategies to mitigate their influence on clinical decision-making. This includes challenging assumptions, actively listening to patients' concerns, and providing culturally sensitive care. Creating a culture of empathy and respect within healthcare settings is paramount. This involves fostering open communication between patients and providers, valuing patients' lived experiences, and creating an environment where Black women feel safe expressing their concerns without fear of judgment or dismissal. Furthermore, diversifying the healthcare workforce is essential to improving cultural competency and representation. Increasing the number of Black doctors, nurses, and midwives can help build trust within Black communities and ensure that Black women receive culturally congruent care. Advocacy and policy change are vital to creating lasting solutions to the Black maternal mortality crisis. Legislative efforts at both the state and federal levels are crucial to address the systemic inequities that perpetuate this crisis. The Black Maternal Health Momnibus Act, for instance, is a comprehensive legislative package aimed at addressing Black maternal mortality through a variety of measures, including extending Medicaid coverage postpartum, investing in community-based organizations, and promoting data collection and research. Advocates are also pushing for policies that address the social determinants of health, such as expanding access to affordable housing, healthy food options, and quality education. Addressing these upstream factors is essential to improving health outcomes for Black mothers and their families. Holding healthcare institutions accountable for providing equitable care is also crucial. This includes implementing bias training programs, establishing culturally competent care standards, and collecting and analyzing data on racial disparities in maternal health outcomes. Despite the grim statistics and systemic challenges, there is hope for a future free from the disparity in Black maternal mortality. By acknowledging the historical context, confronting institutional racism, and implementing comprehensive solutions, we can create a healthcare system that values and protects all Black mothers. This requires a collective effort from policymakers, healthcare providers, researchers, advocates, and community members. It necessitates a fundamental shift in how we view and address Black maternal health, moving from a place of implicit bias to one of empathy, respect, and equity. Investing in community-based organizations, supporting Black-led initiatives, and amplifying the voices of Black mothers and families are crucial steps toward achieving this vision. It is through these collaborative efforts that we can create a future where every Black mother has an equal opportunity for a healthy pregnancy and a safe and joyful motherhood journey. The crisis of Black maternal mortality is not just a Black issue, it is an American issue. It is a reflection of the values we uphold as a society and the systems we have in place. Addressing this crisis requires a collective commitment to empathy, justice, and action. It is time to listen to the stories of Black mothers and families who have been impacted by this crisis, to acknowledge their pain, and to validate their experiences. It is time to challenge our own biases and to work towards dismantling the systems that perpetuate inequities. Every mother deserves to experience the joy of motherhood without fearing for her life. Let us work together to create a future where every Black mother can thrive, not just survive. The time for action is now.